Welcome back to Gentle Dental. Today we have a very special guest. We are going to be learning from Hannah Housewright. She is an extraordinary person. She's a dental hygienist, a mom of four, a proud nana, a friend, and a really great educator. She cares deeply about educating patients on how to improve their oral health, both in and out of the dental chair. In this series, Hygiene with Hannah, she walks you through key hygiene techniques, answers the most searched questions, and demonstrates the real steps behind a professional cleaning, from health history to the final polish. So have you ever wondered exactly what happens when you sit in the chair? Today, I'm going to have Hannah walk us through, from her perspective, what goes on, so you know exactly what to expect.
So usually when we start off a hygiene visit, our goal there is several different things. First of all, when we think of a cleaning, you're coming in because you want to get your teeth clean, but also it usually involves having the dentist come in and do an exam. When we start off a dental cleaning, and I'll just go in the order that I normally go in, we're going to begin from the outside. So we're going to talk about your health in general, not just your oral health, but what's going on with the rest of your body. There are a lot of other conditions that we want to be made aware of before we start the cleaning, not only because of what we're doing in the cleaning that day, but when we're talking about instructing to try to help you be healthier from the mouth all the way out. And so we're going to discuss changes in your overall health. If it's not your first time, we're going to talk about changes. Have you been diagnosed with anything else? Have you started a new medication? Are you pregnant? Are you having any major surgeries? Have you had any major surgeries? Those things we're going to discuss because those things matter. For some reason, we have a tendency to look at our oral health as separate because we go to a different doctor for our mouth than we do for the rest of our body. We're going to talk about the fact that those things are so closely integrated, that your mouth is the beginning of your GI tract, that your mouth is the entrance for how you fuel your body. And so we need to be aware that what's going on with the rest of your body, other diagnoses, other medications or whatnot. When we're looking at medications, not only changes in medication, but we're wondering how those medications are affecting your oral health as well. There are some medications that can affect the gingiva and can affect the gum tissue, and you can see changes in your periodontal health because of that. A lot of medications cause xerostomia, dry mouth, and so when we discuss that, that puts you at a higher risk for decay. Also, are you pregnant? If you're pregnant, we need to be made aware of that, especially if we're doing x-rays or other things like that. The next step, usually after we discuss any changes that you've had in your health and any new diagnoses that you've had, would be x-rays. So why are we taking x-rays, radiographs? Why are we taking new images? And that depends on the patient. And I know in our practice, and generally speaking in the practices I've worked in, that's something that we are looking at with the dentist. The dentist is prescribing those x-rays beforehand, and then that's not just a decision being made by your hygienist, that it's something that the dentist has looked at your risk, your personal conditions, and areas that have been marked as high risk in the past. And so we're taking those x-rays for the purpose of gathering information for the dentist exam. So lots of different kinds of x-rays, and don't be afraid to ask questions about those when you're talking to the hygienist or the assistant that's taking your x-rays. We're taking bite-wing x-rays, is what we call the x-rays that you bite on, that you're looking between the back teeth to try to look for decay between the back teeth. Periapical x-rays are when we're looking around, peri means around, so around the apex or around the root of the tooth, to see if there are any conditions there. Panoramic x-ray is one that goes around the head. We're looking at any pathologies in the jawbone. We're looking at the jaw joint, what teeth have developed, what teeth are there. We're looking at lots of conditions with that panoramic x-ray. When we talk about the frequency of x-rays, we are looking at the risk of the radiation that you're being exposed to versus the risk of decay. And so that's something that, again, that is being discussed with your dentist, and we're trying to decide how often that needs to happen. If you're at a very high risk for decay and for cavities, then we need to take those x-rays more frequently. If you are one of those people that is blessed, whether by biology or because of your own good care at home, to not have cavities as often, then you don't need to have x-rays taken as frequently. Generally speaking, Once we have reviewed your medical history and then taken any x-rays that you need, any radiographs that you need, the next thing will be usually an oral cancer screening. Ideally, both your hygienist and your dentist are doing an oral cancer screening. Oral cancer is a big, scary thing. Anytime we talk about cancer, it's scary. What we're looking for when we're looking at doing an oral cancer screening is we're looking at all parts of your mouth, the roof of your mouth, the floor of your mouth, your cheeks, down around the bottom of your tongue, the attachment of the tongue, your lips, even the outside of your face and the lymph nodes. We should be feeling the lymph nodes, looking at the lips, looking at the borders of the lips. Those are all areas, and especially on the tongue and the lateral borders or the sides of the tongue to check for any changes in texture, color, any lumps or bumps that don't belong there. Those are things that we're looking for when we're looking at an oral cancer screening. Generally, once we've completed that oral cancer screening, the next thing we're going to look at is your periodontal health, your gum health, and the bone structure supporting the teeth. And so how do we do that? Well, what we're going to do is take measurements around the tooth. And I always tell patients it's the little pocket around each tooth where popcorn kernels get stuck. We've all had that experience before. And so what we're going to do is take a very small, what we call a probe, which is a little bit scary of a word. It's really just a tiny measuring tool. We're measuring millimeters, which are very small, and we're measuring the attachment of the gum tissue around the tooth. And so that's going to give us an indication of how healthy those areas are, and we're measuring millimeters. So 1, 2, and 3 millimeters are healthy measurements, and we should be saying those numbers out loud so that you as a patient can hear 1, 2s, and 3s. For example, if you have 28 teeth and we were measuring 6 spots around each tooth, that's 168 points that we're measuring in your mouth. It seems like a lot of numbers, but as a hygienist and as a dentist, we're getting so much information from those numbers as far as the health of the supporting bone and the health of the gum tissue around each tooth. Also, as we're doing those numbers, we're looking at as the area bleeding. If there's bleeding in an area, there's something on the tooth that the gum doesn't like. Ideally, there's no bleeding. That doesn't happen very often. That's ideal health would be that there is no bleeding. What we're looking at is if there's bleeding, there's something on the tooth that the gum doesn't like. That's an indication that there is disease in that area specifically. As a hygienist, when I see that there's bleeding in an area, my first thought is this an area where the plaque is hanging out that the patient is missing? Is this an area where there's some kind of irritation from, food? Has there been trauma in this area? Is this spot just need more attention from the patient? Is this something where I can see a pattern that I can help the patient to see that, oh, okay, I know that you're flossing, but maybe these spots are the spots that you're missing. So it really gives us a lot of information when we talk about the bleeding points. And so those are important to call out and make sure as a patient that you're understanding where you have bleeding so that you can work in those areas. Those spots just need a little more love, I like to tell people. So we're just going to focus more on those areas. We've completed your periodontal chart. Then the next thing would generally be a cleaning. And so what does a cleaning look like? It depends on the patient and their health. Is that a deeper cleaning that requires more expertise from your dental professional? Is that something, a maintenance that we're doing every 6 months? What that cleaning looks like depends on your gum health. And that's why we take those measurements. Preferably at least once a year is the standard. It doesn't hurt to take it every time. But there are lots of parts of a cleaning and there are lots of tools that can be used to clean. And that's a whole rabbit hole to go down. But generally speaking, what we're trying to do when we're cleaning your teeth is we're trying to remove any of the soft plaque that could be causing irritation to the gum tissue, and any of the harder tartar, or the medical term for that is calculus, that has built up on the tooth that can cause irritation to the gum tissue. So that's what we're trying to do, is we're trying to use several different instruments depending on the hygienist and the patient. Combination can be lots of different things to try to remove that harder tartar and then also to remove the soft plaque. We're going to also floss. As when I'm flossing, I'm trying to feel, is there anything between the teeth that needs to be removed? Of course, I'm trying to remove any plaque that I wasn't able to get to with my instruments, but I'm also trying to feel and see if there's any tartar that maybe I didn't get or that you haven't gotten. And then also, is there any restoration or any area on the tooth that the doctor needs to be made aware of that is hard for you to keep clean? Is the floss shredding anywhere? Is there a spot that needs more attention? The next part of your cleaning process is your dental exam. Generally speaking, that would be a part of that appointment. What that looks like and when that happens depends on the doctor and the hygienist. I love when the dentist is willing to come in when they're available, and then we don't have to wait on them. And that's something that works really well for me. Some hygienists don't like to be interrupted, and some dentists want to wait until the cleaning is finished. And I think there's this idea sometimes when the dentist comes in after the hygienist is finished, the dentist is coming in to check the hygienist's work. And that's generally not the case. The reason that the dentist is coming in is so that they can do an oral cancer screening and do their part of checking for decay, going over any concerns that they might have. And when they've come into the room, either when they first come into the room or before they come into the room, they're looking at any radiographs, any x-rays that might have been taken, so that they can diagnose any kind of an issue that you might be having. So I've noticed a lot in my career that when someone is finishing up after the dentist has come in, after I've done the cleaning, a lot of times people are a little bit apprehensive to discuss with the dentist some of the findings that the dentist has had, and then also maybe some more questions that they might have. So a big part of what's happening in your cleaning, patient might have questions that they failed to ask the dentist, that they thought about after the dentist left, or that they would just rather have the hygienist answer for them. And so that's when we would review the findings of the dentist and go over that again and help the patient understand maybe in greater detail what's going on. I know myself personally, I love that experience because it's a time when I get to really help try to use different verbiage if needed, or discuss in a different manner than maybe has already been discussed, in a way that helps the patient understand their options and to break it down more clearly for them if they need that help. Usually during that time, we're also planning the next appointment. We're talking about the next time that they need to come in to be seen for a cleaning. Did the dentist find anything, any treatment that's recommended? Do we need to schedule that treatment? And so generally speaking, depending on the office you work in, you'll be reappointing or getting your next appointment set up with the dentist. What we talk about when we're finished with the periodontal probing is what kind of cleaning needs to happen. So the cleaning depends on the health and the supporting structure of the teeth. There are some conditions that are found during the periodontal measurements that require more expertise from your hygienist to treat. Ideally, that would be found during the first appointment, but sometimes things change between appointments. So it could be a recurring appointment that you show up for, and as your hygienist is taking measurements, there's a new pocket that's deeper than it was before, or there's an area that we're concerned with. And so that's when we might pivot and make changes to the treatment plan. You may have come in for a regular cleaning, we might find something that we're concerned about, and that's our part of our job is to assess the situation and to find out what we need to do in that kind of a situation. So to consult with the dentist and come up with a game plan going forward as far as how to keep you as healthy as possible and how to treat any disease that we might find during the process of your dental cleaning. So when we're ready and finished up for the day and we are ready to make that next appointment, how often you come back depends on the state of health or disease in the mouth. And so if you have periodontal disease that is being treated, it needs to be treated more often. And so between the dentist, the hygienist, and the patient, that's where that conversation needs to happen. Is this something that needs to be taken care of every 90 days? Is this something that you've now become in a healthier state? Could we push that out to 4 months and see how you do? We want to constantly be trying to keep on top of any gum disease that is found. In so doing, we need to be taking those measurements pretty frequently so that we know how well your body is responding to the treatment that we're doing. Anytime any kind of treatment is done, whether that's in the medical field or in the dental field, we need to check and be sure that that treatment, that the body and that the person has responded well to that treatment. And so if you have had to have a deeper cleaning, we call that a deeper cleaning, a scale and root cleaning, a non-surgical periodontal treatment. Those are all the big fancy words that we use for that. If you're needing to have more detailed cleaning done because there is disease present, we need to make sure that we need to follow up on that more often. And also that is because the bacteria that can cause that periodontal disease really like to reform pretty quickly. And so we'd like to see you back the magical number is 90 days to make sure that you're healing well, to make sure that your gum tissue is responding to the treatment that we're doing, to make sure that those pocket depths are ideally becoming smaller, or at least staying the same and not getting worse. And so that's why you might be asked to come back more often. We have in the back of our minds that we're supposed to go to the dentist every 6 months, but everyone's different. And so some people really don't need to be at the dentist every 6 months. They don't have an issue with gum disease, they don't have an issue with decay, and it might be a decision made between the dentist, hygienist, and the patient that that patient needs to be seen once a year. And that's okay too. It really comes down to the state of each person individually. We want an individual treatment plan for that patient to address their individual needs. And so when we talk about somebody that might have gum disease and that needs to be seen more often, it may be a 3-month recall. You come back every 3 months and see your hygienist. You get to see us 4 times a year instead of the average 2. How fun. Or you may need to see us 3 times a year, so every 4 months, and so that we can keep on top of your dental health and your gum health and go from there.
Thanks for watching Dental. Please like, subscribe, and share with a friend. See you next time.